Good afternoon. My name is Chris Royster and this is my patient Greg. Today I'm going to be teaching you about short-term positioning in both supine and prone. Now for those of you that don't know, supine is when the patient is laying down on their back. You can demonstrate. Three main things that we want to take into account for a patient that is going to be short-term in supine is safety, access, and comfort. So safety, we want to make sure that the patient is directly in the middle of the plinth and or bed. Next, for comfort, we want to make sure the patient is just like it's said, comfortable and the most at ease. So in order to do that, we're going to use pillows. The first pillow that we'll place is underneath the back of the head. And the other pillow we're going to place underneath the knees. The pillows are placed at these two places because we want to continue to keep the normal curvature of the spine. So if this pillow wasn't here, then he would have excessive lordosis in the lumbar spine, and we would see the same effect in the head if the pillow wasn't there. So that is safety and comfort. And now the third important thing to remember when short-term positioning in supine is access. So this is where we need to have full access to the patient in order to do stuff like manual therapy. So say a patient needed to have manual therapy on their neck, I would be able to have access right here. Alright, the next thing we're going to talk about is short-term positioning in prone. Prone is when the patient is lying on their stomach with their back to the ceiling. And we're going to keep in mind those same three important things to remember. So for safety, again, make sure the patient is in the middle of the plinth and or bed. And comfort, we're going to place the pillow not over the face because he needs some way to breathe. So for some beds, they have a hole or a square cut into where the patient could place their face. You would want to put either like a towel or a pillowcase right here, just for sanitary reasons. Now for the comfort aspect, for the pillows, we are going to place one underneath the hips. And we're going to place the other pillow underneath the feet. Again, keeping in mind maintaining normal curvature of the spine. And the last important thing is access. So for both short-term, prone, and supine, we want to keep in mind safety, access, and comfort. So the patient is fully accessible to anything that we need to do, whether it's massage, manual therapy, or any other intervention that we have planned for the patient. So that is it.